Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good afternoon and welcome to a late afternoon Ask the Experts. We have got a great show tonight. Before we get started, and I bring my guests on, I want to thank the listeners. Our numbers are off the roof, and it's all because of you. I didn't think that the numbers would go up during COVID, but oh my God, I saw the numbers the other night, and I want to thank everybody, and I'm going to repay you for giving you an incredible show tonight. Tonight is our urology show, our ED show. And let me welcome you to Eric, Dr. Eric Shenvin of Broward Urology Center. This is, without a doubt, the top urology center in South Florida. And listen, he's going to get embarrassed, but it is. I mean, it's true. This is like this. I mean, if you need a urologist, male or female, and I always thought urology was all male, but we learned on the show it's male and female. This is the clinic that you want to go, and you're open now, right, Eric?
We've been open since May 1st.
Okay, so listen, we got a lot of new people tuning in tonight. Tell everybody about your practice.
So there's three of us at Broward Urology Center, Dr. Louis Yogel, myself, Eric Shenvin, and Vlad Gorbati. We are three, I'd say, general urologists, although I myself, as well as Dr. Gorbati, have fellowship training in laparoscopy, endourology, and robotic surgery for Dr. Gorbati. So we carry a little bit of special training and interest in minimally invasive treatments and surgery. We're here in Fort Lauderdale, down in the southeast side of Fort Lauderdale, not too far from Broward Health Medical Center, and easily accessed by multiple ways off 95, 595, and so on.
So I didn't know that that September is Prostate Awareness Month. And I'm going to tell you, there are so many people, you know this, that don't know about prostate cancer until they get it. And then it's sometimes too late. So let's go. We're going to talk about prostate cancer tonight. What is the first thing you do to find out if a man's got prostate cancer?
Well, we screen, and screening means, of course, is that we're going to do a couple of tests. Like any type of screening, the number one best screening test out there is for women, and it's a pap smear to find cervical cancer. And women that get cervical cancer that have not had a pap smear, unfortunately, there's just no excuse. And so we kind of feel that way in prostate cancer. A PSA blood test, which is a specific blood test for the protein that the prostate makes, as well as a prostate exam, just a 2-second finger exam, rectal exam to check the prostate. We can find lumps, we can find an abnormally elevated blood test, and that's going to prompt us to either do other testing or eventually do a prostate biopsy, which takes about 4 or 5 minutes, usually in the office, to detect any abnormal tissue that's cancer in the prostate.
Now, but why would you check a guy? I mean, what are there symptoms of prostate cancer? How would I know that maybe I might have a problem?
Most of the time, there are no symptoms for prostate cancer. Most of the time, it's one of these things that kind of grows silently. And if you really want to know, I'm not going to get into full details on the symptoms, then it tends to be a bad cancer that's already progressed and has been allowed to go too far along, which is why not just what used to be a rectal exam 30, 40 years ago is now a PSA blood test as well, but not either one or the other, but really in urology and oncology, we believe in doing both of them because you're going to miss a patient who has a nodule on their prostate and a not very elevated PSA, which can end up being sometimes a really bad cancer. I actually just had a young patient like that recently. So it's important to really check on both. And we will, again, we might bring a patient into our office if they have urinating complaints or blood in the urine or blood in the semen. But in the end, it's really just going to prompt us to going back to that screening that we do on any man, really once they hit 50 in most men. If there's a family history in one relative, then you're about double the risk of the general population. If you have family history in two or more relatives, you can be over 5 times the risk of the general population for getting prostate cancer. So instead of that old classic 50 years old, we're going to start screening at 45, and occasionally a really strong family history of early cancer in that family, we may start screening at 40 years old. And especially in Black gentlemen who can have earlier onset and more aggressive prostate cancer, we often start screening at 45.
So, but prostate cancer is very common. You always are hearing about people passing from prostate cancer.
Well, I might argue that point a little bit. It's the deaths from prostate cancer have not changed all too much really in the last 20 years because we tend to pick these up early enough most of the time. The deaths that happened 30, 40, 50 years ago don't happen so much anymore. And the deaths that are happening, unfortunately, tend to be that people that didn't get screened. Their
Right.
doctor didn't do it. They didn't go to the doctor. They were in an underprivileged area, underprivileged country, and just didn't get checked. But most of the time, when they get checked, we detect it. Even if it's a little farther along, a lot of times those patients will be living for 10 or 20 years on some type of systemic, through the body kind of almost chemotherapy.
Is it genetically based also? I mean, if my father had it, could I also get it too?
The answer is absolutely. Sometimes I've read a couple of studies about it skipping a generation every now and then, but it's not uncommon for us to find patients that have families where dad had it and there are multiple brothers and sons in the family and they all have it. So again, if I'm seeing that patient who's had a dad with prostate cancer and maybe his dad died from it unfortunately years prior, but now he's had a brother who had treatment for it and he's coming in and maybe just wants to get checked, or his PSA was elevated, or the medical doctor, primary doctor felt something on exam, then certainly, as I say, my antenna is up and I'm concerned about that patient. And we're going to have sort of a low threshold to do a biopsy, but we've cut back on doing biopsies. We've got some other newer tests that when we find some elevated PSAs, not a lump on the prostate, that's very concerning. But when we find elevated PSA, there's some newer tests that we do that are blood and urine based that give us a little more reliability, that are able to tell us a little more certain that we should be doing a biopsy in that patient. Not 100, nothing's 100%, but at
Right.
least cut down to the number of biopsies that really need to get done.
So, what age? I mean, to me, if you don't know that you could have prostate cancer and it could develop, I want to get in there and find out. And how often should I come in for testing?
Once a year is really all we need to do. It's all that's indicated. And there's been a couple of studies, even that when the PSA is below 1, that you could check the PSA every other year. Whether or not you do a prostate exam every year is another story, but generally once a year, starting at those ages we talked about, sort of generically 50 years old, and once a year, both of those exam tests to do.
And do you think they should start at age 40?
only if there's those restrictions. I had a guy in here yesterday, he's 37, and he said, my wife sent me in to get checked. I said, get checked for what? And, he said STDs and my prostate. And I said, well, you don't have any symptoms of anything, and you're too young to check your prostate. There's no family history. And he said, okay, good. I guess I'm good. So I think it's just those guidelines and sticking to them. That's all.
So I'm 68. I've never had my prostate checked. I need to go in and have it checked.
So first of all, I can see me on the, shame on you. Shame on your doctor, I guess.
Yes.
They may be checking a PSA, even if you don't know it. They may be doing the blood test with your annual labs. But again, as I told you, I had a couple of guys recently that I found that had nodules on their prostate. A PSA that, wasn't super low, but it wasn't increasing or rising. But when we feel a hard lump on the prostate, it's cancer until proven otherwise. Unless you could tell me that the urologist or the medical doctor felt that lump like 10 years ago. They tell me every year it's on the right side, all the way towards the bottom and the back. And okay, fine. Then we know it's stable and hasn't changed. But until you can tell me that, that's cancer until proven otherwise. And the only way we're going to know is to check. 2 or 3 seconds. If we ask our moms, our sisters, and wives if we have them, and so on, what they need to go through with a pelvic exam and a pap smear and so on, it's a lot more involved, uncomfortable. And this is 2 or 3 seconds to save your life.
I made a statement before about how common it is. I actually meant like celebrities, big names, because I just heard the other day that Gail Sayers passed away, and it was prostate cancer. He was in his 80s, and you would think someone like that who can afford good medical health would have caught it a lot sooner. Can you catch it sooner before it develops?
Of course.
And what do you do?
And we often do. I mean, the majority of the time we do. And we'll talk about treatments in a couple minutes and so on. But it's basically, knowledge is power, and getting in there and just going to your doctor and getting checked. I think the problem was there was a study out there that showed that you didn't really need, articles about doctors doing too many PSAs and not too many PSAs, rather too many biopsies. And unfortunately, I had a patient that I always remember probably about 8 years ago. He showed up to the hospital. He had been seen by a urologist about 3 years before that, 53 years old right now, coming to the hospital. Comes in with back pain. His PSA is 2,500. He has cancer spread to all the bones everywhere now, completely incurable. And, unfortunately, 3 years prior, he and his wife had said, well, those urologists are doing too many biopsies. And it might have been true to a certain extent, but what they needed was to get evaluated first to make that decision and have a discussion with the doctor. And unfortunately, that guy passed away in his mid-50s of metastatic prostate cancer that probably could have been cured a few years prior. So horrible things like that happen.
We're going to go to break, and when we come back, want to talk about some of the cures. Give everybody your phone number at the office.
Our phone number at Broward Urology Center is 954-463-6408. You can find us on the web at browardurologycenter.com, and you can catch us on Facebook as well.
We're going to go to break, and we'll be back with Dr. Eric Shenvin. We'll be right back.
Very nice.
Are you suffering from erectile dysfunction, also known as ED? The urologists at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954 463 6408.
And we are back. This is the Ask the Expert show. We're on every Monday and Thursday from 6 to 7 to get you home at night. And it's really a very important show because we're talking about prostate cancer tonight. And I'm actually finding out what an idiot I am. That, I hear about people getting prostate cancer, dying from prostate cancer, and it doesn't have to be that way. And, I'm going to call my doctor, the doctor I have to call. I'd rather call Dr. Shenvin, but I got to call him to get permission. I sure hope you're on my list because a person is crazy not to get the screening done.
We'll add you to our list.
Okay.
Not a problem.
But would you agree? Kind of.
It is. We as urologists do the screening, and it's not necessary for a urologist to do an exam and a PSA. We'd be seeing every man in the country at that point. Most of the time it's the primary care doctors, but as I was starting to say, because of a couple of studies that kind of skewed people's views and so on that have been pretty much refuted at this point, patients weren't getting PSAs, they weren't getting prostate exams, and we were seeing less prostate cancer, and we were finding later prostate cancer, and did see the death rate start to go up a little bit. And I think the pendulum has finally swung back now with the American Urology, American Cancer Associations really trying to fight that study that came out. I think one of the things that people ask about that I wanted to bring up was prevention, and is there anything I can do to decrease my risk and so on. And I think some of the things I can talk about are diet and supplements.
I knew you were going to say that.
Supplements are going to help.
I knew you were going to say diet.
Well, the biggest thing that's been associated with prostate cancer, no one's been able to put a finger on it because there's so many factors, are diet high in saturated fat. So a lower fat diet, higher in fish and chicken, and fish oil is one of those. So omega-3, which can come from fish oil and plants, but omega-3 in and of itself has been associated with a low risk of prostate cancer. When we look at the Asian population in Asia, they have a much lower risk of prostate cancer. When you move them here and have a Western diet that, filled with Burger King and Chick-fil-A and Kentucky Fried Chicken and all that good stuff, then their risk starts to come right back up to the Caucasian population for prostate cancer. So diet definitely plays a huge role. Some of the stuff, selenium, which is an element, soy has some mild estrogenic effects, so it can actually inhibit some of the testosterone effects on the prostate, not completely, but soy can be helpful. And lycopene. Lycopene is what you find in stewed tomatoes. That's why Dr. Oz always professes about having tomato sauce every night for dinner. So those things are factors. I take a supplement every day. My dad had prostate cancer at 53 years old and had a prostate cancer
rather than the food.
Well. Yep. So you can try and get all this stuff in your diet, but it's not always so easy. So a company called Theralogics, THERALOGIX.com. Theralogics, you can find them online and call them up. I've been with them, using them for 14, 15 years. They come to our national urology meeting. Definitely high quality supplements, and I've had good results with all their stuff. But I don't want to take up too much time about prevention. I think we were going to mention a little bit about some of the treatment options that are out there and anything else we can get to.
Is there anything else besides diet, though, a person can do?
That is
for
really it.
prevention? Okay.
There's been very loose studies about frequency of ejaculation. If you just think about potential carcinogens, there's been an association with constipation and colon cancer. So if you try and make the association of seminal fluid in the prostate, if the guy's not ejaculating much at all, theoretically the carcinogens are sitting on the tissue or in the tissue longer, but that's never really been able to be proven.
Okay. So it's mainly the diet.
That's
And
really
then
it.
what kind of how do you once you've diagnosed it, then what do you do?
So I think first of all, we talked about doing too many biopsies or quote, finding too much prostate cancer. So every now and then we do find a small fleck, small amount of rather low grade, thought to be clinically insignificant prostate cancer. And it might be something that in 10 years, 20 years, who knows from now, we might not even call prostate cancer. You might call it precancerous. That's too early to be determined, but that's happened in other diseases. And we now have some genetic testing that they do on the DNA of the biopsy tissue that we removed that can give us other indicators of whether or not that lower grade cancer that we took out is going to be more aggressive, less aggressive, or sort of what we thought of clinically without that test ever being around. And so active surveillance is one of the treatments that we've been doing a lot more of in the last probably 10 years. And that still involves getting routine PSAs and prostate exams and maybe another biopsy every couple of years, but it's something that we can do to avoid treatment. Now, as far as treatment goes, the mainstays are really surgery and radiation. And when it comes to surgery, I'll talk about that since I'm a surgeon first, but it's not something that I only point people to. It's whatever is indicated, and sometimes the patient, really their choice. They might be equally well treated with either type. So most people are doing robot-assisted laparoscopic radical prostatectomies. Dr. Gorbati in our practice is fellowship trained in robotic surgery, went and did an extra 2 years after his residency at MD Anderson, where he was already doing some of the robotic
Great cancer
prostatectomy.
hospital. Great
He
hospital.
does all those robotic surgeries for us out east here at Broward Health Medical Center and at Holy Cross Hospital, and has really been the push out east, certainly for our practice in those. When it comes to radiation, you have the external beam radiation, you have seed pellets. Seed pellets have gotten a little gun shy on. They still can be a good treatment for some of the patients. Each and every treatment has its own potential risks and complications, albeit not major and great this day and age because of everything being minimally invasive and much safer than they used to be. The radiation can often be done in a 10-minute session. Patients are not losing their hair. They're not throwing up. They often go to the gym. They go back to work, go to work for the day, whatever it is, and really don't have much of any in the way of side effects. Longer term, we start to look at erectile dysfunction and so on with some of these treatments. So these are some of the difficult patients that I've tried treating with some of the regenerative treatments like the P-shot and the shockwave, but we've been dealing with those for years and we have a lot of good options for the ED side effect with any of the prostate cancer treatments.
You know, we only have a few minutes and we have a lot of women that listen to the show, watch the show. What kind of treatments do you do for females?
Well, we're definitely not prostate cancer. They don't have
No?
prostates, but
Right.
we certainly do see kidney cancer and treat women for that, and bladder cancer. That's really the cancer areas. We do plenty with kidney stones, a lot of stuff with overactive bladder, urinary incontinence or leakage of urine, and just sort of bothersome bladder symptoms. And I've also been doing some sexual dysfunction in women as well, which on multiple different levels. And oftentimes the treatments for that can help with the urinary symptoms that often go hand in hand with those kind of complaints.
I
That's
didn't
about
want our listeners to think that you just handled men only, because you do a lot for women also.
Well, we got Breast
Give
Cancer
every-
Awareness Month coming up at some point soon. So this being Prostate Cancer Awareness Month in September, I wanted to sort of talk a little bit about that and sort of take a break from the ED and low
right.
testosterone stuff.
This is a great topic, Eric. I mean, I've got to tell you, there's a lot of men out there like me, and you know that. And boy, I tell you what, this is a wake up for a lot of men today, this show. And that's what's so great about having you on. Give everybody your phone number.
Phone number for Broward Urology Center is 954-463-6408.
And you got a great website. What is your website address?
Our website is simply the name of the practice. It's browardurologycenter.com. And we're also part of 21st Century Oncology, which is now becoming Genesis Care. And that really doesn't change how we act and how we care for our patients. Actually, what it does do is really give us a close interaction with a great, amazing, high quality network of other cancer specialists and radiation oncology and medical oncology and surgical oncology that I've been very thankful to be associated with.
Well, you're the best at what you do. And Dr. Shinven will be back with us again next month, and we'll be giving you the dates. Thank you so much, Eric. It's so good having you on the show. And
Morning
what a
thought.
great topic.
Just because you had
Go ahead.
prostate cancer doesn't mean it's never time to go back and get checked after treatment. We want to follow men for 10 years. So don't forget, once you get treated, we get patients, they never showed back up after surgery. So
I'm
please
glad
go
you
back to your urologist.
said that. Thanks so much, Eric. We're going to go to break.
Thanks,
When we
Steve.
come back, we've got a surprise guest for you. We'll be right
Take
back.
care. Be safe.
Bye, Eric.